should be able to go live. And then if there's any malfunctions or whatever, I'll let you know. I'll be outside.
So we're live. This is Dr. Khan, Shaher Khan from Executive Plastic Surgery. I am very honored and privileged to have one of my patients who I just operated on last week, 6 days ago. She was the second patient for the day of the 3 explants that I had done. And I am going to go ahead and welcome her in. So now I just had a brief introduction. I just said a quick hello. And so I'm going to have her basically tell me how and in what capacity she has recovered and how she herself feels as we see her for the first time describe her signs and symptoms 6 days out from her explantation, which was done en bloc. What's interesting, as you will see, is when I did her video having done the explantation, on the left side there was a double capsule. There was a capsule on top of a capsule, and this is a video that I'm going to go ahead and post tonight so that all of us can see and learn, and including the other plastic surgeons, to see as to how important it is for the surgery to be done right. And the pathology report is also back, which came back, and we will share that result with you as well, which came back as a foreign body within the capsule itself, consistent again as the impurities slash the toxicities that did leach out into the capsule, which were directly on top of the capsule. Now, having said this, here is Heidi, and welcome her to my Facebook, and as her first post-op visit right after the surgery explantation done 6 days ago.
Hello everyone, really happy to be here. Once I found out that I had breast implant illness and I was able to identify it, one of the things that I wanted to do was be an advocate. I had an outstanding experience. This is day 6. This was the first day that I feel really human.
Sure. Let me ask you a few questions. Before
Sure.
You came and saw me, and I believe you sat in the same chair. You came in with one of your very close friends.
Yes.
What were your signs and symptoms that you were experiencing? What was it part of the breast implant illness that was affecting you, hurting you, causing you to lose your life?
Mm-hmm. Depression was the main one. I wanted to take this opportunity to talk about that because I had severe depression with some suicidal thoughts. And I know that's something that not a lot of people talk about. And I'm probably going to get emotional, and I apologize for that, but it's been a really long road. Everybody that has this illness has their own particular struggle. No one's is worse or better or anything like that. We all have a unique struggle. That was mine. Depression, anxiety, severe joint pain, to the point where from my elbows to my wrists were just, some days I couldn't lift a coffee cup. I'm really active in the gym. I do a lot of strength training. I'm a very strong individual, and there were some days when that was just a huge challenge for me. The brain fog and short-term memory loss is what caused me to leave my career in automotive of 20 years. I had to go on a medical leave, which was extremely hard for me to do. I wanted to continue providing for my family, but I absolutely could not. I reached the point, I hit a wall, and I said, there's something very wrong with me. I don't know what it is. And after going to numerous doctors, no one could figure it out. Everyone was treating symptoms and unable to diagnose me. What else? There were so many, but the premier ones were the ones that I discussed, the ones who were truly debilitating, the ones that caused me to lose my job.
Sure. Now what I'm going to do is I'm going to actually go ahead and go to the chart, and I'm going to show, this is the questionnaire that I have, and as you can see, almost all of the boxes have been checked, from cognitive dysfunction to edema, swelling, weight gain, muscle twitching, and as you can see, the metallic taste in the mouth for someone who's young and healthy. And again, as you will see now, can you go ahead and please tell us, Heidi, how was your surgical experience like?
It exceeded my expectations, in a nutshell. From the very first consult, Jennifer, who is I don't know her title, but she's absolutely wonderful. I absolutely felt very comfortable from the moment I made the first phone call. My husband wasn't able to come to the first consult, so Dr. Khan was kind enough to do a second one. He works 24-hour shifts, so he did something to accommodate him, which I felt very fortunate for, because we know spouses are just as much in this as we are. The team, there were four women that assisted the anesthesiologist, the nurse, there were a couple other people, but from the start, everybody was just so compassionate. That's what I remember.
How is the anesthesia itself?
Outstanding. For me, I now, because at first I thought that I would just be under general. I thought that's the way that it's done. After you explained it to me, why that you do the twilight, I immediately understood, and I have no recollection of the surgery. Because of the comfort level that the staff put me at right before, Purple Rain was playing in the operating room. I want to mention that, which added to my comfort. They were just all very, very kind. They obviously have done a lot of these. They understand the fear and the panic that goes, that we bring into that operating room. Having been through this for the last 5 years, it's significant. And I felt really good. I woke up very well. I felt good afterwards too.
Sure.
Car ride home, I was awake, things like that.
Now, I want you to please let us know, let the listeners know, whoever, as far as how you have improved and what have you noticed in the last 6 days. Mm-hmm. This is post-op day number 6 tomorrow. You're going to be 1 week out. How and what differences have you noticed within the last 6 days having explanted with me?
Immediately, the whites of my eyes, my husband said, your eyes look so different. The swellingness, the puffiness, as I call it. I had so much swelling. Last night I weighed myself and I'm 20 pounds lighter than I was, but that would have been 5 days before that. And I was in absolute shock, and I went to my very good friend and neighbor and I used her scale, because I normally never get on a scale. It's just something I try not to do. And I'm down 20 pounds. And that just goes to show that swelling and inflammation is a big part of this. I don't know, the scale could go up again, but I'm optimistic. In terms of the depression, that's going to take some time. I understand that. But I can tell you that at 2 a.m. when I'm lying in bed in my maternity pillow on my back, which I don't like to sleep on my back, I remember looking out the window and just having hope for the first time in several years. And that really felt good.
How's the
brain
joint?
Fog? Joint pain is non-existent. And I'm telling you that it was debilitating. And I'm sure there are people on the call that will listen to this live that can attest to the level of joint pain. It truly can be crippling at times. The brain fog, everything's clear. My communication is better. I'm not forgetting as much. Tracy Gary put something today on how she had to label drawers to know where everything is. That's very similar to my experience, and I'm not dealing with that any longer.
Sure. Now, it is amazing and surprising. I did 2 other patients that day, and one of them mentioned the same thing about the vision, the clarity of the eyes, the visual enhancements, i.e. back to where they were before, and they were able to basically see very clearly. And again, if I may mention and take the time out, this is where, when the surgery is done right, only can I say with confidence to you and to the patients who's driving home, and as they're looking out the window, that they can say that their entire capsule in its entirety, 100% without fail, was removed. And that's why you bounced back the way you did in a very timely fashion. So there are patients who unfortunately get seen and operated on, and it takes time, if at all, maybe 50%, 70% of the recovery. Because if you remove part of the capsule, you have that remaining burden behind. And guess what? As we move, I'm going to go ahead and show the pathology report. And you can see this is the pathology from 1/7 to 2020. And this is, we're going to put this up. This is the foreign material in the breast left capsule. And you can see the foreign material. And so this is why it is important and integral, basically, that the entire capsule be removed, such that you can have the patient within hours of the surgery recover and enjoy this quote unquote back to a normal state. You don't have any capsules 100%. You have recovered very well just in 6 days. This is supposed to be a very important phase where you're recovering not only from the bruising, and as you will see, the post-operative changes where you're supposed to have pain. You're not supposed, but look at all these improvements, the 20-pound weight loss that you're mentioning, which is significant. This is all the inflammation that your body was carrying and living. What do you have to say to those docs, to those patients, to those other listeners who say that this is all in your head, that this is all a placebo effect, that this is all in your mind, that this is all an imagination?
Yeah, it's very real. I mean, I have suffered for so long, like many of you that are watching this, and I'm just, it's miraculous. And I think it's criminal what's being done out there. I truly do. I went in to get implants. I got the saline because they were safer. You know, a lot of people have been told a lot of things. If someone told me what the risks were, I wasn't listening and I didn't hear. Or maybe they didn't even cover it. It was 13 years ago. But it's got to be stopped. And one of the things that I hope people do is they start doing reviews. They start putting information out there on Google. They start going to surgeons' websites. They start talking about what happened to them to make this more of a reality. Because I think it's only a matter of time. The things that you're doing are going to help start that. But we've got to do it on our own too. I want to use this. I want to be an advocate. I want to spread the word to as many people as I know. I'm not ashamed of what I've gone through. I just want to use it to help others. I truly do.
No, thank you very much. What you have done today, literally day 6, and what we will do is on your next visit, we'll follow along and we'll see how much more improved, because you're still, you know, on the antibiotics that I write for the 7 days. You're still recovering post-op day number 6. And I anticipate as you move forward, as the days progress, the body itself will detox you of all these impurities. The best detoxification, again, is the fact that the entire capsules 100% are removed with absolute certainty, and that you have a fair chance to bounce back to your normal state, a normal physiologic state.
Correct.
Now, if I may take this opportunity to go ahead and answer some of the questions I received over the weekend. The first one was anesthesia. Now, there's 2 different types in general anesthesia that one can offer. The one where you have general anesthesia, where you actually paralyze the patient and then have the patient essentially be at the mercy of the breathing machine and the breathing tube, so that essentially the machine inhales and exhales, and that all the parameters on the machine are being monitored. The chances of a clot are there. Now, this is anesthesia that one would want to get if they were to get a bowel resection or a liver resection, or something like, say, gallbladder resection, where they have to insufflate or put air within the abdomen. So that is the general anesthesia that is almost always warranted, because you want to paralyze the patient so that when they put the air in the belly, there's going to be no constriction. This is overkill. Explantation is an outpatient surgery where the patient only needs to be comfortable and very comfortably safe, so that they have no recollection, as you can see from the feed when one of the other patients asked the prospective patients how they felt about the twilight. Almost unanimously, the decision and the feedback from the patients was this was safe. The patients had no signs, symptoms of any recollection within the operating room. Just like Heidi, as you have heard, the risk of DVT is minimal, and the patient, more importantly, is breathing on their own. They're protecting their own airway. And if there is ever a need that arises where the patient needs to go the next level up, such as laryngeal mask airway or an endotracheal tube, and again, whatever it may be, then I have had the need to go the next level up, I being the commander-in-chief, if you will, making sure with the anesthesiologist and the anesthesia team member that the surgery is done perfectly right, so that we are in absolute control, and that we're constantly looking at the same monitor that we look at and when we are at any major hospital, so that the patient gets the right anesthesia, the best anesthesia, and the safest anesthesia. And this is the top 10 things that I've mentioned in my top 10 things that women and men and patients must know about breast implant illness. The other thing I want to talk about are supplements. One of my patients came and she actually had like a bag load, almost 20 herbal medications. I did not know 70% of them, they were like from overseas, from South America, and she was investing almost like $2,000 per month just taking these herbal medications with the thought that this has been shown to be helpful. Now I find that actually is dangerous because number one, these are not regulated, they're made overseas. Medications such as the ones that I replied to in my Facebook feed, for example, for psoriasis, very much indicated, written by MDs, that absolutely needs to continue. Vitamin D, for example, a lot of women in their 60s have osteoporosis. They need to not only get the vitamin D, but also the calcium supplementation, absolutely important. Now, one of the patients, another patient that I saw today says, I absolutely have to take vitamin C. If you eat a normal, healthy diet, vitamin C supplementation is not required unless there was a deficiency or you've had a malabsorption syndrome, for example, where your physician has dictated or mandated that you need to take vitamin C. Because if you take a lot of it, you could get vitamin C toxicity. So to answer the questions like, vitamin 1 a day for women's health, that I think is very important because in it are the zinc, whatnot else, copper, and all these other magnesium supplements that are important for overall general health. But for someone to take these herbal medications thinking that that's going to cleanse and basically help them with the detoxification for the breast implant, unless I find that is not warranted. Even, for example, probiotics, this has been shown to be detrimental, especially to the kids and the elderly, and it actually hurts the gut flora. Just to eat a regular diet, that in itself is good to replenish the GI flora, and so that the patient has a good gut health. Now, conversely, as a board certified general surgeon, there are many patients who, for example, and another group that may get C. diff, which is a colitis where the bad bacteria within the gut rises and the good bacteria is suppressed. You think in those patients they would want to give the probiotics? No, if anything, they actually give P.O. Vanco in order to bring that down, and the body in itself replenishes and fills up the gut with the right good flora. So to answer the question again, supplementation, unless prescribed by a physician MD and there is a justification for it, like Cymbalta or any of these other medications like magnesium to help with the reg clamps, are very important, and these are important supplementations. But to take herbal medications from over-the-counter herbal supply store where they do have no regulation, that is what I would call relatively concerning consumption of medications which may not be warranted, if that helps. And again, these are very important topics to discuss. One thing I want to again thank my the patient right here, Heidi, who's been wonderful. She did her homework. She came to be well prepared. She saw all my videos. She asked the right questions, and I would call be the exemplary patient. When I asked her in pre-op, what are the odds that you're going to bounce back? And we knew going in the chances for this nice, young, pleasant lady, the breast implant illness was affecting her, and not only her, but her family, her kids, her friends. And just to see her bounce back, this is what keeps me going. And I'm sure there's so many patients out there that can relate to Heidi and say, you know what, we will go out of our way. We will talk about it so that ultimately the patients can make a difference. And certainly she has made a difference today in many of the lives, where I request each one of you to share this with as many people as possible. And hopefully if I can answer any of the questions, we'll be more than happy to. If you have any questions for Heidi and I, we'll certainly resume this next time when I see Heidi so we can follow along and see her progress. She also was nice and kind enough to write a 7-page,
possibly overkill.
But I will tell you that's important because it's all in the details.
Yeah.
See, what we have to do here is recognize this, listen to the patient, and get the feedback so that we can say, like one of my plastic surgery colleagues said, well, affects vision. And he questioned the fact that I understood that. And I said, no, it is very much real. When you have the white of the eyes, the sclera, the vision, and all these improve, not only in Heidi, but the tens of thousands of others, this is again an added proof that it is real, and breast implant illness does certainly affect and does hurt every part of the body.
Absolutely.
Now, thank you very much again, everyone. I look forward to coming back again. I plan on doing my next Facebook Live, I believe, on the 21st on a Tuesday with Darby out of Tampa. Speaking of Tampa, I talked to another patient over the weekend, and she had sought consultation from an explant specialist in Florida. And she was told by this explant surgeon, given her signs, symptoms, and her illness, that she was not a good candidate to remove the capsules, and the plastic surgeon was just going to remove the implants, leaving the capsules behind. And the patient was smart enough to realize that this is not what she was going to bargain for, and that she was going to seek consultation from a board-certified plastic surgeon who was devoted, committed, and determined to removing the entire capsule, such that none of the burden would be left behind. And what is the burden? Look at this final path report again. You can see the final path done last week, 1/7, which shows containing foreign material. This was what was potentially going to be left behind if the capsule was going to be left behind. Having said that, thank you again very much for tuning in. Please share with as many patients, other prospective patients who are interested in implants, so that they can learn better and know better and truly get informed consent. Having said that, thank you again very much. God bless you all. Until next time, bye-bye.